Ladies and gentlemen, today I want to present our study about the association between the mitral valve prolapse and open-angle glaucoma. First, I want to introduce our objective of our study. As you know, proteoglycans and glycosoaminoglycans play many roles in the connective tissue formation. Their accumulation in the myxomatous tissues may influence the associated mechanical behavior of the mitral valve, as well as the extracellular matrix of the eye. The open-angle glaucoma and the mitral valve prolapse may share similar pathophysiology. So, based on this, we hypothesize that the mitral valve prolapse increases the risk of developing glaucoma. About the methods of our study, the research was a retrospective cohort study using a longitudinal health insurance database from the National Health Insurance Program. The database was a randomly sampled population around 1 million, followed for 13 years from 1996 to 2008. There were 21,000 subjects with mitral valve prolapse and 86,000 subjects without mitral valve prolapse were propensity score matched and served as a comparison group. Cox proportional hazard analysis was performed and adjusted for several comorbidities to evaluate the adjusted hazard ratio for the open-angle glaucoma in the mitral valve prolapse group. About the results of our study, the incidence rate of open-angle glaucoma in patients in the non-mitral valve prolapse and mitral valve prolapse group were 10.17 and 0.05 per 10,000 person-years, respectively. The adjusted hazard ratio for open-angle glaucoma in the mitral valve prolapse group was 1.88. A significantly elevated risk of open-angle glaucoma in patients with mitral valve prolapse was also identified in the 4 stratified age groups. The cumulative incidence of open-angle glaucoma was also assessed by Kaplan-Meier analysis. The analysis revealed that the mitral valve prolapse group had a higher incidence of open-angle glaucoma than the comparison group during the follow-up period. Ladies and gentlemen, about the conclusion of our study. This population-based study demonstrated that pre-existing mitral valve prolapse is a significant predictor for the development of open-angle glaucoma after adjusting for possible confounding factors. This is our important findings and the conclusion of our study. Thank you very much. About the flowchart of our study, the random sample of 1 million individuals from 22 million enrolled in our database. The patient with mitral valve prolapse between 1997 and 2008, the total number is 30,000 patients. We excluded the age below 18, exclude only diagnosis of mitral valve prolapse once, excluding diagnosis of specific disease, and also excluding the non-matched patient. So the patient with mitral valve prolapse is total 21,000. Then we get the glaucoma number is 167 and non-glaucoma 21,000. On the other arm, we excluding patient with mitral valve in 1997 to 2008 as our comparison group. So we also get the glaucoma number is 767 and the no glaucoma patients 85,000. This figure shows that the accumulated incidence of glaucoma in patients with and without mitral valve prolapse. We can see that in the years follow-up, the mitral valve prolapse patients have higher incidence of glaucoma, comparing with the patient without the mitral valve prolapse.